There's a scary new combo tonight. Kids suffering from both COVID and the flu. Let's get right to Local 10's Ian Margol live at JMH with our top story. Ian.
What medical experts are saying they are seeing with the Omicron variant is a lot of cases of kids coming into the ER and testing positive for COVID. And now we are also in flu season, which complicates things even further.
It sounds like a monster, Flurona.
A dual diagnosis of the flu and COVID-19, sometimes called Flurona, is now being seen in South Florida.
Saturday morning, she woke up with 102 fever, moaning and groaning in pain.
Anna, who asked us not to show her face or give her last name to protect her family's privacy, tells us her 6-year-old daughter has officially tested positive for both, one of the first publicly confirmed cases in our area.
I'm willing to raise my hand and say, hey, there is one. It's not to be hush-hush about it. It's just like to sort of get people on the ball of understanding that there's like a new thing out there.
Right now, pediatricians and children's hospitals across South Florida are seeing the highest number of positive COVID cases since the pandemic began. And now, with flu season here, there's even more to be cautious of. Dr. Jorge Perez is a pediatrician with Kids Medical Services.
During the winter months is when we start seeing the flu, especially for influenza, RSV, things that are common in children. A lot of these kids are tested. Some of them are coming back positive for both influenza and RSV and COVID.
Dr. Perez says anytime a child is brought in for medical care right now, they are tested for all respiratory viruses. And while their symptoms might be hard to differentiate between, you can take the same steps to avoid all of them.
Good hand washing, masking, social distancing. So I would continue to follow the same thing that we've been following for the last now going to be on 3 years, basically.
So here's the thing. Kids that are having COVID right now, most of them have mild symptoms, but the ones that are having stronger symptoms, things like respiratory symptoms, those tend to be kids who are 5 years old or even younger, down into 2 years old is what they're seeing right now. And those kids are not old enough to get vaccinated. So the best way to keep your kids safe, obviously wear those masks, hand washing, social distancing, and get your vaccines and your boosters to make sure you don't get it as well, or at least get a much lesser version of that virus. Live in Miami, I'm Ian Margol, Local 10 News.
A COVID testing company says there is now a case of Flurona here in Southern California, which is getting COVID-19 and the flu at the same time. The case was detected at a testing site at the Getty Center in Brentwood. The patient is a minor and just returned from vacationing in Cabo San Lucas with family.
Symptomatic person under the age of 18 that did test positive for flu, in addition to SARS-CoV-2, drove here and left here with parents in fairly good condition and not hospitalized.
It's not clear how severe that person's symptoms are or if they are still positive for the illnesses. Both the flu and COVID are respiratory diseases that can cause similar symptoms like a cough, runny nose, and a sore throat. Health experts say that the biggest risk is to people with underlying conditions or those who have not been vaccinated.
Hello, I'm Mark Brown. Get more great ABC.
Well, a health alert tonight. Israel is reporting its first case of what's being called the Flurona. That is when a patient gets COVID-19 and the flu at the same time. The case was found in an unvaccinated pregnant woman who had mild symptoms. She was released from the hospital last Thursday in good condition. Some reports suggest this is the first official case of dual infections. The World Health Organization says co-infections are very rare. And on top of that, a new COVID variant has been detected in France. It is called IHU. It's been detected in 12 people so far, and those cases have been linked to travel. IHU has not been found in other countries so far. And we, of course, have a list of all the places where you can go to get tested for COVID or even the flu over on our website. It's fox35orlando.com. We also have a story posted going over the differences between the flu, COVID, and a cold.
There are new health concerns this morning. The first known case of a person infected with COVID and the flu, called Flurona, I hadn't even heard it until this morning, has been detected here in SoCal.
Not at all. CBS 2's Tina Patel is live at the Getty Center this morning, where that first case was discovered. Tina, good morning to you.
Good morning. What people here at this testing center realized a few weeks ago is that not only are we dealing with this Omicron surge, we are also in the middle of flu season. So people were coming here showing symptoms and they didn't really know what they might have. Take a look at this video. What they had started to do was asking people if they showed symptoms, if they wanted to get tested for both COVID and the flu. And they say 4 days ago, a man or a boy under the age of 18 did test positive for both. He and his family had just returned from a trip to Cabo San Lucas. He was the only one feeling symptoms and the only one that tested positive for both COVID and the flu. We are told he started recovering at home. His family checked in yesterday and said he is doing much better. One parent has now come down with COVID, but so far no one else with Flurona. Now here's what the health experts at this testing site tell us about what they want people to know if they are feeling sick.
You know, from the time that you have your exposure, approximately 2 to 3 days thereafter is when you really should be getting tested, right? And, or of course, if you have any cold or flu-like symptoms, definitely get tested. And out of an abundance of caution, we tell folks, you know, it's a good thing to quarantine. Quarantine is showing to be one of the best, methods to really flatten the curve.
Now, again, hearing something like Flurona sounds very scary. In this particular case, the boy only had mild symptoms. He is doing well, but it is something that health experts want you to be aware of. And they say if you are having symptoms, you can try to see if you get tested for both COVID and the flu so you know what you're dealing with. In either case, best to quarantine and stay away from others so you don't spread whatever it is that you have.
LA County may have its first case of Flurona, a combination of the flu and the coronavirus.
And the possibility is ramping up with the fears of a possible twindemic. Gigi Graciette is live at a testing center. This is near the Getty in Bel Air with more on this developing story. So many people were posting about this yesterday, Gigi.
And a lot of folks at Roxia thought it was some kind of a joke or a new name for COVID-19, Flurona. It's not. It is the combination of influenza and COVID-19. It's real, and it may very well be here in Los Angeles County. Take a look at the video. Flurona has been confirmed, at least the first case in Israel, with a pregnant, unvaccinated woman testing positive for both influenza and COVID-19. Now, this is believed to be the first official case, but health officials say that many people may have had both the flu and COVID-19 as early as 2020. Now, here in Los Angeles at the 911 COVID-19 testing site, officials say a child tested positive for both the flu and COVID-19. The boy had just returned with his family from a trip to Cabo in Mexico. Influenza and COVID-19, of course, are both contagious respiratory illnesses, but they are caused by different viruses. Flurona, yet another concern for healthcare workers as the COVID-19 winter and post-holiday surge flows right into the flu season with a substantial rise in the number of new COVID cases and hospitalizations being seen here in Los Angeles. Here at the testing site, the positivity rate they're seeing is skyrocketing.
We've passed the 30% mark, which is, our New Year's resolution was to flatten the curve. And simply put, it's now turned into a nightmare. And, the technicians, there's fatigue. It sometimes feels like there's no end in sight.
And just to give you an idea, we were here 2 days before Christmas, and the positivity rate was at about 14%. Before New Year's, just last week, it was at about 22%. And you heard Steve Farzam there talking about what they're seeing, and that's a 30% rate, positivity rate. Tomorrow, they will begin offering a test for influenza in addition to the COVID-19 test. It can be done from a single nasal swab. Reporting live this morning, I'm Gigi Graciette. Back to you.
There is increased activity in flu this season compared to last season. They do expect to see more cases of co-infections. Flurona is not one disease. It is 2 infections happening in one person. Flurona is basically a co-infection of influenza and SARS-CoV-2, which is the virus that causes COVID-19. Co-infections with any viruses or pathogens have existed before COVID-19. It's not clear whether it would cause more severe disease, but the good thing is that there is treatment available for both viruses, SARS-CoV-2 and the influenza virus. Doctors are basically just going to treat them simultaneously. Another silver lining is that actually co-infections, especially with influenza, are relatively rare. Experts are saying that this twindemic scenario is unlikely to happen. Flu was virtually non-existent last year because of all the masking and social distancing and people staying indoors. So there wasn't a lot of opportunity for people to get the flu, let alone get the flu and another virus. Experts speculate that, they can see more cases of co-infections of influenza and SARS-CoV-2 this season as we start seeing flu cases rapidly rise and we start to see COVID cases rapidly rise, driven largely in part by the Omicron variant, which is highly transmissible. The number one thing that experts are saying is to get vaccinated for COVID-19, get boosted if eligible, and also get your flu vaccine, which you can do both at the same time. The CDC says that it's safe to co-administer the flu vaccine and the COVID vaccine. So you can kill two birds with one stone.
Hey, thanks for watching.
That's what they believe, Michaela. Good morning, everyone. We're at the 911 COVID testing site here in Brentwood. This is on Getty Center Drive in Sepulveda, where the lines aren't too long right now, but people began lining up to get tested about a half an hour before they even opened this morning. And we are talking about Flurona. It is real and it is here. Israel has confirmed its first case of dual infection in an unvaccinated pregnant woman whose symptoms, thankfully, are said to be mild. And while this is being referred to as the first case, it is believed that many other people have had both the flu and COVID-19 at the same time, as early as spring of last year. And now LA County may also have a case. Officials at the 911 COVID-19 testing site here in Brentwood say a child tested positive. Now, let's bring it back here live. Joining me now live, Steve Farzam. He is the COO of COVID 911 testing site. Steve, very briefly, this family returned from Cabo San Lucas. The little boy, or the young man, was he's under 18, wasn't feeling very well. You tested him for both the flu and COVID-19, and what were the results?
So this minor was positive for SARS-CoV-2 in addition to influenza A.
And he was the only one in his family, but his mom did test positive later on, but just for COVID?
Yes, on the initial test that they did on the night of their arrival, only one person, which was the minor, tested positive. Everybody else tested negative. The following day, the parent tested positive for just COVID and not influenza.
Now, you've got 3 testing sites. You've been monitoring what's been happening in Israel with this talk about Flurona, and you were starting to roll out the flu test in what you called a beta test, and that's why you had it handy to test this little boy?
Exactly. We twofold. Just the fact that our resources are being so inundated with the vast amount of folks who are getting tested, and we're seeing a lot of folks who do have some basic, cold symptoms, getting repeated tests, showing up literally almost every day of the week. And
for a COVID test.
Exactly, for a COVID test. And then we figured, maybe they have an underlying influenza case. So if we can capture an influenza positive early on, then we could presumably prevent them from having to come back every day, so we can save those tests for the people who really do need them.
Because almost every single day, you're testing almost 3,000 people a day, and almost every day you've been telling me you're down to 3 tests at the end of the day. You're on the verge of running out almost every day.
Yeah, we've had so many other testing sites reaching out to us and trying to get supplies. We're launching 2 additional sites just here in the next 3 days, and it's been a challenging time. And the brave women and men that worked on the front lines here, we're charging ahead, but it's been challenging, but we're getting through it.
All right, and just last thing, your positivity rate has jumped up. I was here December 23rd. That's the first day I met you. Positivity rate was 14%. New Year's week, it was about 22%. What is your trend right now?
So we're just past last night the 30% mark, up from nearly 2% a month ago. It's the blizzard is in full effect, and we're feeling it.
Steve Farzam. Thank you very much, Steve. Now, Flurona, of course, that's a name that's being used for coronavirus and the influenza virus. It is very possible that you could get, they are two different viruses. And the concern here, because the symptoms are very similar, Michaela, the concern is our healthcare system overwhelming them. You know, folks are reporting, shortages, staff, healthcare workers are getting sick themselves. Hospitals, Santa Monica Urgent Care told us just yesterday the wait to see a doctor there is 3 hours, and that is the big concern with Flurona.
And you make a good point, Gigi, because remember, while all this is going on, there are people that have other very serious and pressing medical issues. So people with cancer treatments, with ongoing therapies, diabetics, they're having trouble getting access to those physicians.
Exactly, and a lot of surgeries are presumed to be elective, so they're being postponed right now. And Michaela, the truth is, a lot of folks have underlying conditions and they don't even know it. And then when they come down with COVID, they end up finding out they have something much more serious.
All right, well, those folks at 9/11 COVID testing are going to be busy, as you had said. 30% infection rate, my goodness. All right, Gigi, thank you.
Well, as if we don't already have our hands full with COVID, Delta, Omicron, there's a new condition that has entered the mix.
It is called Flurona. It's when someone gets COVID and the flu. I can't deal with this. Ed Laskos live for us tonight in West LA. Ed, say it ain't so.
I wish I could, but it is so, unfortunately, and doctors are concerned about it. So talk about pandemic burnout, huh? A new health threat now that we have to worry about. So think about it. If you catch COVID-19, unfortunately, your immune system's in a weakened state, so you are then a prime target, high risk to catch another infection, the flu, all at the very same time. And add to that all as we're right in the middle of this latest surge. Check this out. 911 calls already surging as the Omicron variant explodes through the Southland. The surge striking at the worst possible time, winter, and the start of our flu season, bringing a new health threat called Flurona, being infected with COVID-19 and the flu all at the very same time, with the very same symptoms, all attacking your respiratory system.
Oh, it's absolutely scary. It's terrifying. COVID, especially in an unvaccinated person, can feel absolutely terrible. And if you remember, influenza doesn't feel so good either.
The first confirmed case of Flurona now detected in Israel, a woman in her 30s, suffering the same symptoms from two separate infections, raising concerns here a twin epidemic could be on the way.
It is absolutely a possibility. Right now in Southern California, or in California as a whole, we have relatively low rates of influenza. Typically, flu doesn't begin in Southern California until around mid-January, so we're coming up on it really soon.
That as the explosive COVID surge has testing sites busy already, most with lines and wait times, a skyrocketing demand for testing that's even overwhelming ERs and urgent care centers, even before we're hit with a possible flu surge.
Already at Santa Monica Urgent Care, we're seeing 3-hour waits today. It's rough out there.
The LA City Fire Department facing a big increase in its 911 calls, now implementing its ambulance surge plan as LAFD tries to free up more ambulances as wait times are growing longer for patients who need available beds.
We'll send an emergency medical supervisor to that hospital. They work with the hospital staff. They really determine what the underlying issue is, and then that way they're able to expedite the release of ambulances.
Doctors still insist COVID and flu vaccines, both of them, are the best protection now from Flurona and a possible twindemic that could hit this winter.
It's hard to predict what's going to happen. Look, we can't predict anything that happens with the coronavirus pandemic. What makes you think we can predict what's going to happen with the flu right now? We're living in crazy times.
Crazy times, the doctor says now live. How crazy? Well, listen to this. Last year, remember, not much of a flu problem or outbreak around because of all the safety measures we were taking, so you would think that would be good, right? Not really. It turns out we might be more susceptible to catching the flu this year because our bodies did not have a chance to build up the immunity against the flu last year because it simply wasn't around with all the infections. The good doctor says middle of the month to the end of this month is when flu season really kicks into high gear here. We'll see what happens. Keep our fingers crossed. Hold your breath.